Welcome back. We mentioned macular degeneration among the leading cause of sight loss in the U.S. For folks over 55, it's estimated nearly 1.5 million Americans will develop this age-related problem in the next 5 years. And here to discuss more of this is Dr. Brent Reed of Griffin and Reed Eyecare. Doctor, welcome. Nice to have you on board today. Tell me, how do folks, so 55 and over, is it just something that happens because of age?
It's primarily related to aging. To understand what happens, the center of vision in the back of the eye, which is responsible for color vision, fine point discrimination, tends to go through an aging process due to accumulation of certain toxins that we come up with as byproducts of normal metabolism. And some people are more susceptible to that than others.
So, and it certainly has an effect. I mean, it's not just a physical thing, but it's pretty depressing.
It has a tremendous effect. In fact, a really recent study, the age-related eye disease study, showed that at least 1/3 of the patients that have this problem, to whatever degree, have significant problems with depression, as one would understand. When you lose your ability to read, to ambulate, to be able to drive your car, to watch television, it's a horrible disease.
Now, there are two forms of macular degeneration. There's dry and wet. What's the difference between those?
The difference really has to do with whether or not you're growing new blood vessels or not. The dry form is kind of an accumulation of these toxic byproducts that causes some distortion in vision, but not significant disability. Most people that have dry form can still drive. The wet form is where new blood vessels begin to grow to try to repair that damage, and that form is horrendous because it can lead to a quick decline in vision to the point where legal blindness is the outcome in most cases.
Now, with both forms, dry and wet, are they treated the same way?
No, they're treated differently. Dry form is mainly treated at this point by the use of supplements, vitamin supplements, which I was always skeptical about. But the recent studies show that vitamin C, E, particularly zinc, elemental zinc, and lutein have to have a very positive effect. Some evidence vitamin A in the form of beta carotene has a positive effect, but one has to be careful because that can induce, or has been associated with, lung cancer in smokers. So you have to be careful about vitamin A intake if you're a smoker. But I advise all my patients over the age of 35, 40 to begin to take some supplements to help them out.
Well, I was going to say, yeah, I guess you can start any. I mean, supplements are good, especially if you don't eat a well-balanced diet, but this certainly would be of assistance nonetheless anyway. Is there any way, besides the vitamins, of preventing the onset?
Actually, unfortunately not, but there's a couple things you can do to help stave it off, possibly if you have a family history. One is do not smoke, and if you do smoke, quit. Two is get good exercise, because it has a lot to do with circulation and the ability of the eye to be perfused with blood, and good blood supply, good oxygenation. So those are some things you can do. That and taking the supplements is probably the best thing you can do, and be checked if you have any family history, so that hopefully, as time goes by, we'll be able to do better treatment for these things for people.
Any potential on the horizon for a cure? You know, it seems like we're 5 years away from curing everything.
I know, it's amazing, isn't it, in medicine? That's the way it's been since I was in med school 20 years ago. There are a couple things that are very promising. One is a laser therapy that seems to have some promise for the early form of wet macular degeneration. But there are also some drugs out there now that will prevent the growth of these new blood vessels that will actually stop wet form, and that's probably the most promising thing on the horizon at this point.
All right, doctor, thank you for